There is actual policy guidance on joining the military with a diagnosis of ADHD. Admission of someone who has ADHD into the military versus somebody who has it and is not permitted in the military kind of depends on the path that that individual has been on in regards to treatment and intervention.
The military is a unique environment with its own set of challenges and opportunities. For neurodivergent individuals, navigating this landscape can be particularly complex. How does the military accommodate neurodiversity? What are the experiences of neurodivergent service members? And what advice do experts have for those considering enlistment? We're talking to Dr. Brandi Walker, a retired Army clinical psychologist, about the challenges and opportunities faced by neurodivergent people in the military. That's straight ahead on episode 245. I'm Emily Kircher-Morris, and this is the Neurodiversity Podcast.
What is neurodiversity? You see the world differently.
Autism spectrum.
Gifted.
Complexities that are inherently inside.
ADHD.
Dysgraphia.
Tourette's.
All brains are different.
You are exactly what this world needs.
This is the
Neurodiversity Podcast.
It's hard to believe that the countdown is on for the release of my new book, Neurodiversity Affirming Schools, Transforming Practices So All Students Feel Accepted and Supported. My co-author, Amanda Morin, and I are impatiently waiting for January 21st for this book to be out in the world, while at the same time panicking that it's going to be out there in such a short amount of time. We've got some fun things on the horizon as we launch this book out into the world, and we feel strongly that it is going to be a game changer for teachers and their neurodivergent students. We can't wait to tell you all about these exciting things, but in the meantime, you should check out our social media pages so you don't miss anything, or you can pre-order the book now. All the links are in the show notes. Okay, Dr. Brandi Walker is here with me in a minute.
previously on the Neurodiversity Podcast.
It's not just the accountability piece. I think kids build self-esteem from being accountable and successful when they do things independently. And I think sometimes when we swoop in to save them, we steal their self-esteem a little bit. Mm-hmm. And that, I think, is can become a slow development of learned helplessness. And I completely do not think the intention is negative from parents at all. It's not malintended. It's meant to be helpful. But going back to just like your physical muscles, you have to let your children exercise those executive functioning muscles, even if it doesn't always work out.
That's episode 222. Find it wherever you get your podcasts.
Today, I'm joined by Dr. Brandi Walker. Brandi is a recently retired Army clinical psychologist, and she is now in private practice in North Carolina. She focuses on ADHD, executive leadership, and lots more. So, Brandi, thank you so much for chatting with me today.
Thank you so much, Emily. Thanks for having me. I love what you guys are doing.
You and I were actually connected originally by the amazing Dr. Sharon Saline, and we had the opportunity to present together with Sharon at the annual International Conference on ADHD last year. But before we even get into all of that, I'm fascinated by your range of interests and expertise, and I was hoping you could share a little bit about how you became an Army clinical psychologist and what it is like to be a psychologist in the military. What's the same or different from working in a community setting?
That's a great question. And oh my gosh, I have a ton of stories. I'm going to spare you because I know we got limited time. But the short and sweet is I was in the military, and my first job, believe it or not, I was a fuel handler, right? So,
oh, wow.
We would refuel vehicles, right? Aircrafts like helicopters, Apaches, whatever, right? So we would refuel them and they would go back to doing whatever they were doing, whatever the mission was. And it was during that time, I was like, oh my gosh, this is not for me. My first assignment was Korea. And I had this huge fuel truck that I had to drive from one side of Korea to the other side, right? Now, it's probably about an hour and a half drive. It's my first job in the military. So I was pretty young. And I had my supervisor was this E5, right? Sergeant. Mm-hmm. And this guy was really big. He looked like a bulldog, right? And so he's like, "You gonna drive this truck, Private?" And I'm like, okay, I'll drive it, right? But if you know anything about Korea, the roads are really, really narrow, and they're one lane, right? So we're driving up this crazy mountain, and I got this huge 5-ton truck, like old school too, right? So these big tanks on top, and then this huge trailer with another tank of fuel attached. And he's in my face, like right here. He's like, "You better drive this truck. We need to get there such time." And I was just like, and then, I mean, when he's talking, I could feel like the spit particles landing on my face. And so I was like, I am not going to continue in this job. Like, this is not the career path for me. So that day when we got back, I wrote in classes and started my education journey. And so from then I got my associates and eventually my bachelor's. And when I got my master's, I got a master's in counseling, right? Rehabilitative counseling. Mm-hmm. And so I was like, yeah, now I can work with soldiers and help people with PTSD and like do therapy. And the Army was like, no. Like, either you're going to be a licensed clinical social worker or a licensed clinical or counseling psychologist. And so I was like, well, if I already got a master's in counseling, I don't want to get another master's. So I'll go ahead and do like a doctoral program. So I ended up going to Howard University and then eventually coming back full time as an Army clinical psychologist.
I mean, so what's it like just being a psychologist in the military?
It is a very rewarding experience. You know, we love our service members. It's fascinating because you are a soldier, but at the same time, you're also caring for them. And so you understand, you know, what their life is like, but you're also kind of held to those same standards. Mm-hmm. And so there's a level of compassion and understanding that allows you to advocate for them, but you're incredibly busy. Mm-hmm. There's so much work to be done because just like anywhere else, there's a shortage on providers. And so, you know, if you're assigned to a unit or brigade, which I was, you are considered a behavioral health officer. And that means you have a lot of people, you know, that you're responsible for, probably like a unit. And the size varies. So it could be maybe 500 people or close to 3,000. And you will generally have a counterpart, but it's still a lot of territory to cover. And while you're providing, you know, therapeutic support, you're also advising your leaders, you know, these soldiers, commanders, and their supervisors on the best way to support them, the best way to boost morale and stuff. So, you know, it's a pretty interesting balance.
I mentioned that we co-presented on ADHD.
Yes.
And I would love to know what it was that brought ADHD into your focus and how did that become an area of interest and specialization for you?
So a little bit of a funny story. I got tons of them. But so what I learned that I needed to get a doctoral degree, I was like, okay, I want to go. I researched and I found out that Howard University was doing a lot of work in the community, very collaborative. And I was like, okay, I definitely want to do something in the community. And so I've always had a focus, actually dual focus on pediatrics, like the kids, adolescents. And so I got trained as a child psychologist and kind of like family psychologist. That was my training track at Howard. And so when I got there, they was like, what's your research going to be on? And I was like, what you talking about? They was like, you got to do research. Like this is what we do. We do research. And I was like, okay. Let me see. So, you know, they tell you all the faculty that are doing research at the school. And so they're like, this person is working on this and this person is working on that. And I was like, okay, well, I want to work with kids. And I actually wanted to look at, you know, the dynamic where fathers are not in the picture. Like, how does that affect development? Mm-hmm. And then we started talking about, you know, the prevalence of children when a father is in the picture. What does like ADHD or neurodiversity looks like compared to when there isn't, you know, male presence, a significant male presence? Does the development kind of still look the same? And so that's kind of where I wanted to go. But the clinician supervisor that I went with, she does a lot of work with families. And so there was solid alignment there, but she is a sleep expert. And so she was like, whatever you're working on has to do with sleep. So we ended up looking at ADHD and the sleep quality, and then the difference in, between kids whose medication status changes. If they get medication all the time versus if they don't get any at all versus if they get medication like during the week, but not on the weekend. And we were really looking at the sleep quality, looking at the family relationship around ADHD symptoms, but also around, sleep and how that's impacted. So that's kind of what got me on a path of ADHD. And then I just kind of continued my dissertation research, like in the field with military populations.
I don't know if I've ever mentioned this on the podcast or to you, actually, but I was actually supposed to go into the military right out of high school. Had I ever told you that before?
No.
I was in the delayed entry program for the Air Force, and I had been accepted to become a cryptologic linguist.
Wow.
And so I remember, though, when I was going through that enlistment process, there were questions that my recruiter had about my ADHD diagnosis and medication, et cetera, et cetera. And so I wasn't prevented from joining, but I really don't honestly remember all of those details that went into that conversation, and I'm sure they might have changed since then. So I'm wondering if you have any insight into what it is like for recruits who want to enter the military, but they have a diagnosis of ADHD or autism, and what are the limitations that are there?
So there is actual policy guidance on joining the military with a diagnosis of ADHD. And it kind of varies because, I won't say that the guidance varies. The guidance is pretty clear. I'll talk about that a little bit, but admission of someone who has ADHD into the military versus somebody who has it and is not permitted in the military kind of depends on the path that individual has been on in regards to treatment and intervention. And so we know ADHD is kind of like still on a spectrum in a sense of the severity of your symptoms and what does that look like? Basically, the best way to explain it is the more severe your symptoms, the less likely you will probably be afforded an invitation to join. And the reason why that is because of, what's required of a soldier. So when we're not at war, it doesn't seem as intense. A lot of our service members, we do have, they, not we, they, and they do have some pretty intense, robust training schedules. Now, on the one hand, a person with ADHD who has a lot of energy and they need an outlet for it, those training exercises could be fantastic. All of the physical fitness is a great way to kind of manage some of the symptomology. But then on the other hand, a lot of things are required, they do require discipline and they do require really being able to be attentive to the mission and what's going on. So it kind of depends. And so someone who's had a 504 plan, IEP, and all of these things utilize a lot of the accommodations could probably experience more challenges joining the military because the military is kind of saying, are you able to manage the diagnosis without all of the support? Because if you're in a war deployment type situation or environment, you may not have access to those resources, but we will still need you to do the job that, you're trained to do. So it kind of comes down to that. If medication has been in the picture, I think within the last 2 years, they're looking for your last 2 years prior to joining to basically be ADHD medication free. And so we don't tell anybody to don't take your medication
right
for 2 years. It's more like if you're really wanting to join the military and you do use medication, determine is that the route to go? Can you maybe look at a job that serves the military, but you're still a civilian? Or can you learn enough coping strategies and skills to really effectively manage it, without needing meds?
Yeah, it's interesting because I often think about how neurodivergent people might really add a lot of benefits to the military based on some of their strengths that they have, but those types of policies might prevent them from joining. I actually, as I was preparing for our interview, I found one recent study that said almost 77% of young Americans aren't eligible for military service without a waiver, either due to weight or substance abuse or health conditions, which would include mental health and neurodivergent diagnoses. And so that waiver process, it sounds like that's kind of what you're talking about, where maybe they have that diagnosis, but they haven't been on medication for a couple of years. And so, like, when does that waiver piece come into play? Are you familiar with how that exactly works?
Yeah. So in actuality, if you have the diagnosis and you didn't necessarily need an IEP or a 504 plan, you were able to make some kind of accommodations or develop coping skills and strategies, and you weren't on medication within the last couple of years of you trying to enlist, then you don't even need a waiver, right? You just basically are probably a good fit appropriately, right? And can kind of navigate the recruitment process without needing a waiver. So if you've had an IEP or a 504 plan in your educational process, that's when you apply for a waiver. Or if you've been taking medication and maybe you've been off the medication for a year, but it hasn't been 2. The Air Force may say 18 months and not 2 years, right? And so it hasn't been 18 months. You can apply for a waiver.
And so that varies from branch to branch. It's not necessarily consistent across all of them?
Yes.
Yeah. Okay.
Each branch, the Army is slightly different from the Air Force, and I'm not 100% sure what the Navy asks for. Now, I'm an I was an Army psychologist, so that was kind of where my training was. And the policy guidance we follow was more directed toward Army population. But then everybody's mission is different. The Air Force mission is different from what the Army does. And so that's where you could see some flexibility in what the requirements may be.
Yeah. Just out of curiosity, not directly related to ADHD or autism, but I do feel like a lot of times there are people who are neurodivergent who maybe take medication for, say, like anxiety or depression. Does that kind of follow the same protocols there? And do those diagnoses impact enlistment in the same ways?
Yeah. So if you have anxiety or depression, those are also things that could keep you from joining the military too.
Yeah.
And so again, in those situations, you would probably need a waiver for those things as well. To your point, ADHD and neurodiversity in itself, like, autism, they do have a tendency, more likely than not, maybe anywhere from 50 to 70% to have a comorbid condition. So they would have to disclose if they actually have a formal diagnosis of depression or anxiety as well, and ask, for a waiver for those additional conditions too.
I'm sure that you have probably worked with, obviously, a lot of military members who are neurodivergent, but maybe they didn't even realize it when they enlisted or they came to a diagnosis as an adult, maybe after a child was diagnosed. I'm curious about the experiences of neurodivergent military members and your work with them. What is that like for them?
So it depends. Those who don't know that they have undiagnosed ADHD tend to have a fair amount of challenges, maybe with their leadership or with the mission requirements, or just the routine, the rigor of the routine of a soldier's daily life. Or they run into issues with their team, getting along with their team members, or even in a deployment setting. So when they're having challenges, the service member may not themselves come in and say, hey, I'm having a lot of problems. Some of them will, but some may not. And so for the ones who don't, they typically are identified by their leaders. Their leaders are like, such and such is having an issue with this, with that. We want you to... they will ask the psychologist to kind of basically check in with them, or sometimes we call it a fit for duty, where you do an evaluation and you're kind of checking to see what's going on with them. If they self-refer and they come in and they're having issues, the conversation with them, you can kind of start asking those clinical questions to get an idea of if ADHD is in a background. But for some, they may have issues somewhere, but generally they're still pretty good. Yeah.
You're mentioning, ADHDers who might struggle with some of the routine, but I think sometimes that highly structured format might actually help mitigate some of those struggles that they have, where it's like the expectations are very clear. And so, it can be a lot of different ways that might manifest. I'm sure that there is some level of stigma surrounding coming and asking for help because probably of some of the things that you're talking about. And I'm just wondering, how did you as a clinician handle that as far as wanting to be supportive, wanting to help them understand themselves, wanting them to, but also balancing that with recognizing their role within the military?
Yeah. So once you're in the military, you are in.
Yeah.
So if you come forward and say, this is a diagnosis that I have, or these are things I'm struggling with, and we do psychological testing because everybody, when they're experiencing a certain amount of symptoms and issues, they start Googling and figuring out, okay, maybe it's this, maybe it's that. And so when they come in, they're like, I think I got this, or I think I got that. And I'm like, well, let's see. So we'll do like a pretty solid clinical interview. And from there, we may do some psych testing to kind of see if there are significant differences in cognitive functioning, right? So if I see a significant difference in working memory, processing speed compared to somebody's fluid reasoning or their verbal reasoning skills, then that's an indicator that, there is some neurodiversity and ADHD could potentially be in a picture. Like you said, when you have that diagnosis, you could thrive, absolutely thrive in a structured environment. Autism, tends to show up for in the aviation world as well as in intelligence.
Yeah.
You have people with really, really high intelligence levels, and there are some compromises in the social domain. It could be definitely undiagnosed, or it could be diagnosed and just well managed.
Yeah.
I think normalizing it, because if we know that 10 to 12% of the population has it, then that's going to still ring true for a military population.
Yeah.
And some will be, some will know and some will not know. And then it just keeps becoming an issue until they come in and get the care that they need. But once you're in, you get the care that you need. If medication is in a picture, then you will need like waivers throughout your career for the different things that you want to do. One, to see if you can get the medication you need wherever you're going, as well as teaching you coping skills and strategies to mitigate challenges.
I want to talk a little bit about masking.
Okay.
Because it kind of aligns with what we were talking about. I suspect that there are some traits, kind of like we've talked about, that are associated with neurodivergence that fit really well in the military. So I'm thinking of like the serviceman or woman who thrives on that routine and consistency might be an exceptionally good fit.
Yeah.
Or I could be wrong on this, but this is my perception, is that I think that the direct and kind of low context communication that I would assume is typically used in a military setting might also be great for some of those individuals who maybe struggle a little bit sometimes with those hidden social rules. It's like, no, it's very clear what's being said and what's meant. And so there might actually be some neurodivergent military members who actually don't have to mask as much as they might in other environments outside of the military. But just in general, when you've worked with some of the military members who were struggling with the masking or trying to suppress some of those skills, how did you approach that? How did you help them?
I'll be honest, in the military, right, wait, let me just say this first. Okay. Everything that I say are the views of mine.
Yes.
They do not represent the views or the opinions of the DOD, Department of the Army, DHA, like any of those organizations, or the U.S. government. So let's be clear about that. I'm speaking from my own experiences and the things that I've learned and observed. In a military environment, there is a fair amount of masking anyway, right? It may be masking depression, masking anxiety, masking PTSD symptoms. So that's kind of happening anyway. Particularly, the higher you go, the less you want people to think that there's something wrong with you.
Yeah. And
getting the care that you need, people really still feel there's a amount of stigma related to, going to a behavioral health clinic, seeing a provider, seeing a doctor or a shrink, So the perception of military people they're like these strong warriors. But the mission, fighting wars and all of this rigorous training, your mental agility really needs to be in great condition. And so we try to help people think about getting the care that they need or taking care of themselves and being as psychologically resilient as possible as like, hey, this is just as important as like, working out or eating well or, taking care of a physical injury. So the masking happens. It's always a thing just because of the image of your traditional warrior.
Yeah. Yeah, that makes sense to me. I appreciate the way that you contextualize that. What about military members who are parents of neurodivergent kids? I mean, is that something that you ever talk to anybody about or help them kind of figure out and support? And what's that like for them? Especially, I mean, I always assume a lot of military families are moving quite often, those types of things. But what were your experiences there?
Yeah, honestly, that was kind of like the basis of me justifying wanting to continue my dissertation research and look at military populations specifically because of those cultural factors in a military environment, right? The constantly moving, not being, as strongly rooted in your family because you're probably on the other side of the world or 5 or 6 states away. And so hanging out with cousins or seeing grandma and grandpa, like that doesn't, it just doesn't happen. And so all of those things are protective factors, right? Mm-hmm. And so when you add the genetics of ADHD kind of being passed to a kid, you add the stress of like military life with all of the moving pieces, then the likelihood of a child developing ADHD or some type of neurodiversity does increase. It means it's just the way it is, right? So yeah, we work around that. And a lot of times we talk about routines. We really talk about the support, the identity of the individual, right? The individual service member, as well as the child and family, building compassion and empathy around neurodiversity. The best way is to support anybody who's dealing with it, and of course, leveraging that child's strengths, the things that they're interested in, the things that they're good at, and still building into them accountability, responsibility, things like that. But just creating an environment where they can still flourish. And of course, making those connections with, school teachers and, just having more of a circle of support where there is like a holistic approach to thriving.
Sounds a lot like what we do in other settings. It's just a little bit different for where they are, what's accessible, and again, normalizing it for those parents as well in how they support their kids.
Yes.
Brandi, this conversation has been so fascinating, and I love talking about all of the things, but this does bring me to our final question. So
okay.
I was wondering if you have any advice or thoughts for a young neurodivergent person who might be considering entering the military.
Yeah.
Is there any advice that you would really want to pass along to them?
Yeah. So a couple of things. I actually did do a webinar for Attitude Magazine. So if you want to Google that has like, oh my gosh, it's like an hour worth of conversation, but there's some statistics and a lot of good information there. Attitude actually did a few more articles related to the subject matter so that you can Google those and find that information. And then in addition to that, my encouragement is number one, if you absolutely really want to join the military, try to be the best soldier you can be. And what that means is that you're going to take care of yourself holistically, mentally, physically. And so in the mental component, really being able to, if you're taking medication, not stopping your medication, having conversations with your provider and telling them what your goals are, what it is that you want to do, and creating a plan where as that you can have conversations with a recruiter, and you can understand kind of where you fall, where you stand, and then you start kind of building a path of what it looks like to get there. And if your path is like, no, I absolutely need my medication, then you look at maybe another path of supporting the military as a civilian. There's a lot of opportunities where you can do a lot of the things the military does, and not necessarily be in a force. But if you are able to have a combination of behavioral strategies and things like that, maybe there's changes to your nutrition and your diet that really help you manage, the symptomology to a place where you realize you don't need the medication. If you're doing that, then just make sure you're safe. You have your prescriber or your provider involved, and you all take a process where you have time to see how you navigate stress or a rigorous routine, unmedicated with just behavioral coping strategies to get there.
And we will put a link in the show notes to all of those resources that you just mentioned from Attitude Magazine. That'll be great. And so, Dr. Brandi Walker, thank you so much for your time today.
Thank you. Thank you. Thank you.
There are a lot of reasons why the military might be a good option for neurodivergent young people to consider, but there are lots of other factors that can influence that decision. Being informed about what will allow or preclude someone from joining the military is important for high school-aged teens who are considering their post-high school pathways. I was recently talking to a teacher whose husband is a retired Marine and whose son is a student at West Point. She said her husband often suggests to young people who are considering the military that joining the reserves first, which requires completing basic training and some additional commitments, can be a good starting point for someone who might think they would enjoy a career in the military. If you're in the reserves and choose to go to active duty, you can do so. But if you're enlisted, you're committed for your 4 or more years, and there's no way to drop back to being a reservist before that time is up. I thought that was a good option to consider, and one I'd never heard suggested before. Deciding on a pathway as one enters adulthood is huge, and for some, the military might be one to consider. I'm Emily Kircher-Morris. I'll see you next time on the Neurodiversity Podcast.
Thank you again to Dr. Brandi Walker. If you want to know more about what she does, or if you'd like links to her work, they are in the show notes. Also, you can pre-order Emily's new book with Amanda Morin, Neurodiversity Affirming Schools, Transforming Practices So All Students Feel Accepted and Supported. There is a link in the show notes as well for pre-order. Also, remember to like and subscribe to our YouTube channel. You never know what you'll see there in the future. Our host is Emily Kircher-Morris. I'm the executive producer, Dave Morris. For all of us here at the Neurodiversity Podcast, thank you for listening, and we will see you next time. This is a service of the Neurodiversity Alliance.